Hi, in this video I'll be discussing about stomach gastric cancer. Stomach cancer, also known as gastric cancer, is the growth of cancer cells within the lining of stomach. Usually, it develops in the mucus-forming cells that line the stomach. Stomach is a muscular organ located left side of the upper abdomen. Stomach processes food that comes in from our mouth down to the esophagus and enter the stomach through the lower esophageal sphincter, a muscular valve. Stomach secretes acids and enzymes to digest food. About the disease, about 1 to 3% of stomach cancer is hereditary according to study. Another risk factor is use of tobacco, alcohol addiction, overeating of greasy and fatty foods. A risk factor is anything that increases a person's chance of developing cancer. Although risk factors often influence the development of cancer, most do not directly cause cancer. Some people with several risk factors never develop cancer, while others with no known risk factors do. The following factors may raise a person's risk of developing stomach cancer. For age, stomach occurs most commonly in people older than 55. Most people diagnosed with stomach cancer are in their 60s and 70s. For gender, men are twice as likely to develop cancer as women. And bacteria. A common bacterium called Helicobacter pylori, also called as H. pylori, causes stomach inflammation and ulcer. It is also considered one of the main causes of stomach cancer. Another factor is family history and genetics. People who have a parent, a child, or a sibling who has had stomach cancer have a high risk of the disease. For race and ethnicity, it is more common in Black, Hispanic, and Asian people than in white people. For diet, eating a diet in high salt has been linked to an increased risk of stomach cancer. Last year, an estimated of 26,560 was diagnosed with stomach cancer. It is estimated that 11,180 deaths in the United States occur on 2021. Stomach cancer occurs most often in older people. About 60% of people who are diagnosed are older than the age 64. The average age of diagnosis is 68. On this page, we will discuss how doctors describe a cancer growth or spread. This is called the stage. One tool that doctors use to describe the stage is the TNM system. Doctors use the results from the diagnostic tests and scans to answer these questions. For tumor, how deeply has the primary tumor spread into the stomach wall? For the node, has the tumor spread to the lymph nodes? If so, where and how many? And for the metastasis, has the cancer spread to other parts of the body? In the picture in this page, it shows the stomach cancer and its stages. So for stage 0, this is also called as carcinoma in situ. The cancer is found only on the surface of the epithelium. The cancer has not grown into any other layers of the stomach. This stage is considered an early stage. For stage 1, the cancer has grown into an inner layer of the wall of the stomach. It has not spread to any lymph nodes or other organs. For stage 2, stomach cancer is called stage 2 for any of these conditions. The cancer has grown into the inner layer of the wall of the stomach. It has spread to 3 to 6 lymph nodes but not elsewhere. The cancer has grown into an outer muscular layers of the wall of the stomach. It has spread to 1 to 2 lymph nodes but not elsewhere. The cancer has grown to all of the layers of the muscle into the connective tissue outside the stomach. It has not grown into the peritoneal lining or serosa or spread to any lymph nodes or surrounding organs. For stage 3, stomach cancer is called stage 3 if the cancer has grown into outer muscular layers of the stomach wall. It has spread to 7 to 15 lymph nodes but not to other organs. The cancer has grown to all of the layers of the muscle into the connective tissue outside the stomach but has not grown into the peritoneal lining or serosa. It has spread to 3 to 6 lymph nodes but not on other organs. The cancer has grown through all the layers of the muscles into the connective tissue outside the stomach and has grown into the nearby organs or structure. For stage 4, stomach cancer describes a cancer of any size that has spread to distant parts of the body in addition to the area around the stomach. Stomach cancer is usually not found at an early stage because it often does not cause specific symptoms. When symptoms do occur, they may be vague and can include those listed below. It is important to remember that these symptoms can also be caused by many other illnesses such as stomach virus or an ulcer. Indigestion or heartburn, pain or discomfort in the abdomen, vomiting, particularly vomiting up solid food shortly after eating, diarrhea or constipation, bloating of the stomach after meals, loss of appetite, sensation of food getting stuck in the throat while eating. Symptoms of advanced stomach cancer may include weakness and fatigue, vomiting blood and having blood in the stool, and unexplained weight loss. It can be diagnosed through biopsy, molecular testing of the tumor, endoscopy, endoscopic ultrasound, X-ray, barium swallow. Stomach cancer can also be diagnosed with CT scan, MRI, PET-CT scan, and laparoscopy. This section explains the type of treatments that are standard of care for stomach cancer. Standard of care means the best treatments known. When making treatment plan decisions, you are encouraged to consider clinical trials as an option. For treatments, there is surgery, radiation therapy, therapies using medication, and chemotherapy. Stomach cancer is usually not visible and does not cause specific symptoms. It is usually not found on the early stage to prevent it from spreading. If some of the mild symptoms has occurred constantly, it is best to seek professional help. If cancer is diagnosed, relieving the symptoms is an important part of patient care. Cancer rehabilitation may be recommended. A follow-up will also be important to monitor the occurrence of the tumor. Thank you for watching my short video.